Learn how to create a detailed clinical note using axiUm. This guide will help you navigate patient records, select procedures, and complete all necessary documentation confidently. Begin by selecting the patient record you wish to work with from the patient list. Search for your patient's name if needed, then double-click their name to select their chart. Navigate to the side panel and select EHR to enter the patient chart. Prior to starting your procedure, ensure you review the medical history by clicking on the Health History tab. This needs to be reviewed before requesting a start. Once you are ready to start writing your note, navigate to the TX History tab. From the TX History window, click on the note icon in the upper right corner to add a new clinical note. A new window may appear. If it does, select Template Note. Template notes have easy click to fill templates pre-made for use. The general note should not be used when completing procedural or consult notes. Another window will now open for template notes. To select the template you'd like to use, begin by clicking the three dots icon in the upper left next to the code line. An extensive list of available templates now appears for you to select from. You can either scroll through the list and select, or the preferred method is to search. Click on the drop-down box next to Search and select Description. Now that you are searching by description, you can type in the criteria box for keywords associated with the procedure you just completed. For our example, we are writing a clinical note for an adult prophase, so we will search for the hygiene template. Once you've found the template you want, double-click the name to launch the template. Now that your template is selected, assign the note to the clinic which you are currently working in. For our example, we are completing an adult prophy in CCU. Each section of the template note will have a spot to add information. Most of these spots are required. Some fields are drop-downs only, while some are free text. All information to populate the note will be completed in this area. For our example, the first required field is asking us to select a procedure from the drop-down menu options. After making your selection, click Next to move to the next field. This field is a free text field. For this portion of the note, it is asking us to input our name as the provider, so we will type SDR, John Doe. From here, you will work through the template to complete all required fields. Required fields will be indicated by a red asterisk in the word required between the prompt box and next button. Don't forget to include your next visit. This is a free text box where you can include as many items as you wish. If you need more room when writing your next visits, or any free text for that matter, click the multi-director arrow button to expand the window. We also need to add in the appointment length. Very important for the front desk staff to know this information to schedule appropriately. Once you complete your note in its entirety, click OK at the bottom of the window. To view your note, click on the Notes section under the TX History tab. Scroll through the Notes section under TX History to find your newly created note. Notes in blue can be edited up to 24 hours following your patient appointment. Notes are auto-locked once this 24-hour period has ended. Notes that are locked appear in black color text. This guide walked you through creating a comprehensive clinical note using a template, including selecting patient records, choosing procedures, filling in detailed clinical information, responding to prompts, and finalizing the note with accurate assessments and ratings.